Hello there, Sarah Fahara here. Welcome. So glad that you're able to join today where we're talking about fatigue. Feeling tired, feeling wiped out, feeling like you have nothing left to give, done for. These are not uncommon feelings. Fatigue is a really big deal. It's a huge area of interest for me in my work and my private practice as an integrative registered dietitian. Something that I'm developing a course around that I have a free guide around on my website at sarahfaharard.com. Thinking about why fatigue matters, I've got a really impactful statistic for you. The National Safety Council, a leading source for occupational safety information, estimates that 69% of employees, many in safety critical industries, are tired at work. You and I both know, think back to the last time you've only got a few hours of sleep, that when you're tired, your mental performance lags, your physical potential, how quickly you react, your reaction time suffers, and even your outlook or emotional state can decline in some way. Fatigue can be defined in a few different ways or thought of in terms of some different categories. One, the inability to initiate some kind of activity, the get up and go factor. Second, a reduced capability to maintain activity. Perhaps you got out of bed, you started your run, but you weren't able to keep going to maintain the level of activity. You just fatigued too quickly. A third category would be difficulty with mental fatigue, difficulty maintaining concentration, perhaps with memory, and even emotional stability concerns. Here's the thing: what you do or what you don't eat, and equally as important, how your body utilizes or doesn't utilize the nutrients that you consume can play a significant role in your energy levels. Although it's common to try to overcome or beat back fatigue with one more cup of coffee or energy drinks, these substances or quick fixes can act as a kind of band aid that covers up the root causes, a term that you'll hear a lot in functional nutrition and functional medicine. If you're able to dig below the surface and figure out what's contributing to your fatigue, especially as it relates to what you're eating or not eating, utilizing or not utilizing, it allows you to promote from a much deeper level long lasting improvements in energy levels versus just something that lasts for the very short term. Thinking about where to prioritize our time here today, I decided to pull out three factors, although there are many more, many more for sure, but three factors that feel really the most important to me personally. Two are focused on nutrient depletion, whereas the other has to do with a condition called non celiac gluten sensitivity, which we'll dig into and define in just a minute. The two nutrients that come to mind with energy and fatigue are B12 and iron. Now, there are more than 10 different nutrients, more than a dozen actually, that are closely connected to fatigue. But in the interest of keeping this podcast under 2 hours, these two come to mind because they are really not only common deficiencies, but are also really very misunderstood. Before we dig into the details, I want to clarify a couple of terms for you. Those terms being deficiency versus depletion, because we can run into trouble when it comes to fatigue and B12 and iron with either deficiency or depletion. Now, full blown deficiency of a nutrient represents the end stage of nutrient depletion, where symptoms are at their worst. But you can think of nutrient status as being on a continuum where nutrient dependent functions work less and less efficiently as nutrient depletion worsens. Okay, so let's look at how this concept applies to iron and B12 status. First, iron. When you think about iron, you probably think about iron deficiency anemia. That is the deficiency state, where the red blood cells, which transport oxygen, needed, of course, to prevent shortness of breath, to maintain energy levels, right? Think about circulating oxygen blood flow. So, where they shrink and lose their hemoglobin, which is a protein that carries oxygen within the red blood cells. Some symptoms of iron deficiency anemia include fatigue, no surprise, exhaustion, but also, perhaps less well known, restless leg syndrome, a headache, and of course, difficulty catching your breath and paleness. That hemoglobin is red. So you see it even in your skin and your nails, even underneath your eyeballs. You can see a little bit of that iron deficiency or depletion because it gets really pale. But here's the thing. These symptoms can start fatigue, headache, restless legs, even before full blown iron deficiency because levels of hemoglobin only decrease when severe iron depletion is present. But iron stores can be depleted before then, can be decreasing. So already you're starting to notice some of those symptoms. What impacts iron status? Well, there's a whole load of causes that can lead to iron depletion or deficiency. Inadequate absorption, inadequate ingestion, of course, a low iron diet or a diet that's not rich in what we call bioavailable iron, increased blood loss or excretion, inadequate utilization, perhaps some kind of a condition, which we'll talk about in a minute, which doesn't allow you to fully utilize or absorb, as I said before, the nutrient, an increased requirement as during certain phases of life. Some of the conditions that are commonly associated with iron depletion are inflammatory bowel disease, a history of gastric bypass, celiac disease, H. pylori, and atrophic gastritis. Some medications which can reduce absorption of iron salts would be tetracycline, proton pump inhibitors, and even over the counter antacids. Now that we've talked about a variety of factors which could impact iron levels, let's think a bit about B12. B12 is really interesting because it can contribute to both physical and absolutely a sense of mental fatigue. Not only because B12 in and of itself causes a different type of anemia than iron does, but also because B12 depletion can lead to decreased synthesis of something called myelin, which you can think of as a sheath which wraps around nerve cells in the brain and really helps to conduct your brain signals or electrical impulses, allowing them to transmit quickly and efficiently. Some of the symptoms of B12 deficiency, and man, there's a list, are tingling in the feet and hands, poor memory, trouble focusing, and fatigue. Really big deal. So, what are some leading causes of B12 deficiency? Well, these include strict vegetarian or vegan dietary patterns without supplementation, some genetic traits, malabsorption, some stomach or intestinal surgeries, and again, common medications such as proton pump inhibitors, H2 receptor antagonists, metformin, cholestyramine, and even chronic use of anticonvulsants or antibiotics. The third factor that feels especially important to mention is non celiac gluten sensitivity. This is a term used to describe individuals who have intestinal signs or symptoms extra intestinal signs or symptoms not occurring in the intestine, or both, related to ingestion of gluten containing grains with improvement when these are removed from a patient's diet. Non celiac gluten sensitivity is thought to be more common than celiac disease. And while the path uh, to occurrence or pathophysiology is not totally clear, it does seem that there could be a role for a amylase or trypsin inhibitors, which drive intestinal inflammation via a pathway called toll-like receptor 4. This receptor and these inhibitors have been suggested to play a key role in what we call the innate immune response of gluten related disorders. Some of the symptoms of non celiac gluten sensitivity include fatigue, headache, diarrhea, and cloudiness of consciousness. I think of that as brain fog, all of which can cause you to feel really, really run down, physical, and also mental fatigue. These are just a few important considerations, and they are hardly black and white. For instance, if you suspected non celiac gluten sensitivity, it would be so important to think about the time and the place to embark on self experimentation, thinking about what symptoms you are hoping to target, what you're looking for on reintroduction, whether or not you've had celiac disease screening completed, and thinking also about what you're pulling out and what nutrients you might need to replace if you were to exclude certain foods from your diet. So just to encourage you, a well-trained integrative registered dietitian can help support you in not only troubleshooting or identifying possible reasons for fatigue, but also in making sure that each of those components are built into a comprehensive plan that leads no stone left unturned, right? So, in summary, with these three big considerations, don't be overwhelmed. That was a lot of information and just a list of considerations. But, one of the wonderful things about nutrition and, food drug interactions and nutrient depletion versus sufficiency is that there are practically always potential changes that you could make to optimize your energy and mood in some way. If you'd like some support in starting to piece together some of the many nutrition related factors that can contribute to fatigue, visit my website at sarahfeherard.com. Download my free guide, 5 Surprising Superfoods to Find Freedom from Fatigue. And always feel free to drop me a note. Let me know what you're struggling with. Let me know how I can help so we can create a plan that truly works for you. I hope this was helpful. I hope that you enjoyed this, got some new information that you can apply. And most of all, I hope that it brought you some clarity as you move along your health journey. Until next time.